Hey, good morning. The time being 9 o'clock. I'm calling to order the meeting of the Human Services Committee. I'm Michael Linder. I'm the vice chair of the committee in the absence of Chairman Surges. Call the roll, please.
Allen, Garcia,
Garcia by Zoom.
Gripe,
Right here.
Lewis,
Lewis here.
Tarver,
remote.
Mr. Tarver.
He's there. I see him.
I cannot hear you though.
Yeah, hear you.
Tarver's here.
Okay, thank you. Linder, Surges, Roth.
Roth is here.
With the use of your ex officio, you have a quorum.
Okay, thank you.
Okay. We have remote attendance requests from Ms. Garcia and Mr. Tarver. I'm uncertain whether Mr. Surges will be joining us remotely or not. I have a motion for unanimous consent to approve the minutes of November 12th, 2025.
Gripe moves for unanimous consent of the meetings from the last meeting.
Any objection? Okay. Public comment, seeing none. We can move right into the monthly financials, which are on file. Any questions about those? Okay. Ms. LeBreau, insurance review.
Thank you. The reports are included. If there's any questions, I'm happy to answer them. I did want to add, just so everyone is aware, there is a new fee or tax, I'm not sure what you'd call it, to the state of Illinois that's coming out of our health insurance fund, in case you missed it. It was House Bill 1697 and House Bill 767 that adds a $15 per employee per year charge to the prescription drug. It's the Prescription Drug Affordability Act, and it goes into a fund that will provide $25 million in grants to community pharmacies, according to the state. So it's per participant per month. So it's looking at somewhere between $15,000 and $20,000 a year that will be coming through. So that'll come out of the health insurance fund. It's not going to be something new you see. It's going to be rolled into the health insurance fund, but it'll impact future rates.
And we paying that monthly? We're paying it one time?
So Blue Cross is going to start working it in monthly at $1.25 per month rather than $15 per year. And then they will pay the annual fee on our behalf.
Thank you.
Mr. Chair, quick question.
Yes.
Did the state of Illinois have to explain how charging $15 more to every participant makes makes prescription care more affordable for those you're charging $15 a month to?
They're using that money to give it to community pharmacies.
What makes it I'm curious, what makes it community?
I have no idea. I've never heard of a community pharmacy before reading this. So
Okay, good. Thank you.
Probably not Walgreens.
probably not Walgreens or CVS. It must be, honestly, I have no idea.
We don't have that many independent pharmacies
Yes, they
anymore
can.
around here.
No, I certainly could do some research on it if you were interested, but I'm not sure off the top of my head.
Okay, risk management, Dave?
Good morning, David Larson, risk manager. So nothing shocking to report so far this winter. It's been relatively mild, and of course I'm saying that and it's snowing now. So we'll see what happens. But right now you can see the reports. Happy to answer any questions on what you've seen. I've had the opportunity so far to at least have an initial visit at each work site. So those initial contacts have been helpful. They'll bear fruit, I'm assuming soon, as I continue to coordinate with those departments and offices.
Thank you. Yeah, I think Building Services is doing a good job so far with snow and salt. Nonetheless, it's inevitable that we'll have
Yes.
some accidents there, which just happens.
And they have been very responsive to any requests that I've had.
Yeah, and they've actually solicited from staff to say, here, call this number if you see a problem area, which is great. It's great. Okay, staffing.
The staffing reports are included. I just wanted to add that we're going to be changing the dates that you see. Right now, you see the previous month, but our committee is so early in the month that a lot of times the ones on the second half of the month haven't been received and captured. And then we're moving on to the next month, the following month. So I'm going to start backing it up a little so that we don't have that gap. So for example, this month, I left it the way it was because I wanted to mention it before we made changes. Rather than seeing November in December, you would see October in December. And that way you have a complete final picture of that month. I can certainly include the following month to date if you want, but understand that it's not complete. Because payroll cannot put in a termination until their final paycheck has been issued, which can be as much as 2 weeks after their final workday.
Okay, thank you. Anything else on staffing? No? So we move on to the training report. We're getting near the end of the year.
We're wrapping up those. Everybody's familiar with this now. The first couple of years, it was challenging getting everybody on track, but we really have had great participation from the staff, and it's requiring a lot less individual phone calls and emails to get everybody going. So you can tell from the numbers that we've got good response from everybody, and so we continue to be on top of making sure we're compliant, and we are. And just thanks to everyone who does it without us having to nag you.
Yeah, that's kind of gratifying to see people jump on and get it done.
And January 1st, it all starts again.
Oh,
But we are hoping to get potentially a new video if we use the one that's offered at no cost by the Illinois Department of Human Rights, but we're looking at options. If there's any other free options that meet the requirement, we'd love to mix it up a little bit for everyone because I know it's been the same video year after year. So we'll look at that.
Okay. Mr. Surgis has joined us. No objection?
No.
All right, thank you. Did you have something, Mr. Roth, or was
I
that?
was just gonna say, I saw
Okay.
him online.
Good, thank you.
Thank you, guys.
Is there any old business anyone wants to bring up?
What was your comment?
New business discussion on county code updates for consistency. Whose issue is this?
Mr. Surgis is.
Okay, Mr. Surgis.
Good morning. Hey, as we have several years ago, if I can take shape on this, several years ago, we began discussing the inconsistencies that we have in the county code. Some of which were left knowingly, obscure. Other times, they were just in conflict because one board may have said this while another board may have said that. And we have tried valiantly. I mean, the last attempt was with Mark Davis just a few years ago to try and get things streamlined. I think we are to the point now with some of the cleanup that we've done that we should probably, and Jamie helped me out on this, but we should probably do an evaluation and dive in to say, okay, are we talking about 3 things or are we talking about 300 items that may be in conflict, going forward? And once we identify them, what would it take to clean them up? Is it a matter of saying, hey, this was, enacted 40 years ago and it's just not pertinent, we should undo it? Or did we really do something without dotting the I's and crossing the T's recently that was in conflict with something from years past? Jamie, am I shaping that properly?
Yes, this was something that the state's attorney had kind of brought up when we did the last ordinance and said, this is fine, but you should know that there's places throughout code where little things are addressed in terms of department heads. And there isn't a lot of consistency to it. And most people don't even know, for example, that there's part of the finance code that talks about the director of finance. Most of it's in 248, but as it's scattered and it's difficult to find. And they said, so these things really should be cleaned up and corrected, especially given the ordinance recently passed, to make sure that everything's clear and understandable and there's no confusion. So that was something that they had brought up, that I passed along to Mr. Surgis. So it's really up to this board, this committee, If you want to have the state's attorney flag all of those issues and make a recommendation for correcting it and what you would like that to look like.
Jamie, if I could,
Mhm.
is that something that the state's attorney would undertake, or we would do that departmentally?
The state's attorney would flag the problems, right? They would go through and say, this is inconsistent, this is inconsistent. They would be the ones to review the code and tell you where there are things that are not consistent with each other or the different parts of the ordinance. Then it would be up to this committee, and I certainly can assist you however you would like me to decide what you want it to be. Do you want to strike that part and you've got it covered elsewhere? Do you want to create a section that relates specifically to department heads so it's all in one spot? That's a decision for the board.
Has this already been started and they're keeping a tick list of, here's the items that we should be looking at, or are we starting from scratch and recreating it?
Well, the state's attorney had, like I said, when we passed last ordinance, they had in mind a couple of these things. And, we had talked to you at the time, these things, they kind of conflict, right? They don't necessarily talk about the exact same thing, but they kind of, they're written at different times for different purposes. And so they're non-consistent in that it was their recommendation. So I think they already know what these items are, but we have not dove into them at all. So to dive into them would be it's a part of the same process you've been undergoing, I think, but whether or not you want to look at those individually, you want to look at them in a whole, you want to have the state's attorney present, you want me to bring them to you, that is all a choice for this committee. That's why it was put on there, why you had it put on as a discussion item. You need to give direction as to how you would like this addressed.
It would
Jamie,
make sense to me that we go ahead and let the state's attorney do that because they have volunteered to do it and they're also kind of professional at reading the language. In the bigger picture, I think the whole code, not just that relates to department chairs, not just that relates to human services. I think the whole code is due for a review. And that's something we probably need to bring up. In another
Mr. Chair?
committee. Yes, sir.
So if I could respond to Jamie, it would seem to me that the totality of this and how we address it really matters in terms of the quantity. I mean, if we're talking about 3 or 4 items, this is manageable. But if, like, when Davist dove in, it proved to be, a Herculean task. I don't want to set expectations that, hey, we can have this done by the end of Q1 and then find out, oh, golly, this needs to be broken down into component parts that may take us a year. So just to set expectations, it might be that, if we can work on the list and kind of say, any way we could have that by February and then kind of digest it before moving forward. If I could suggest that.
Yeah, I think what you say makes sense. If they came to us and they say, you've got these 4 items and we can look at 3 of them and change them or dictate what should be put into a resolution to change them or an ordinance, depending. That's easy. If there's 47 of them, yeah, it's
Exactly.
a totally different thing. And so I think letting them go ahead and tag them for us is a starting point.
Mr. Chairman,
Yes, sir.
yes, Ken Shepro, State's Attorney's Office. I think, Cliff, in answer to the first question you asked, whether it's Jamie or the state's attorney, I think the answer is it's really both working together at the committee's direction to identify how long the list is and then make a recommendation, or the committee will make a recommendation as to how much they want to digest in one gulp.
Right. We need
Because
Ken,
I
I'm
was-
sorry. What I heard you say is you wanted Roth and Juby to tackle this whole thing, and
Art. We'll take care of the agriculture.
Let the minutes show that Miss Allen has joined us.
I mean, you're quite right that the entire code has got lots of things, but I don't think that's where you start because that
No.
could be a year-long project. It's going to involve, almost every committee. And I think, you isolate what this committee wants to do and
Okay, so would it make sense that we have a consensus of the group that Ms. LeBeau work with the state's attorney to facilitate them doing a review, bringing it to you, and then you bringing it back to committee as you see fit, possibly prioritizing this one could be a problem tomorrow. That's right. Does that make sense?
Yes.
Do we need to take any formal action on that or just nod and say, do it?
No formal action is
Okay.
needed. I just wanted to make sure that that was what the committee wanted us to do.
That's good. Then thank you. Ms. Allen moves to place reports on file. Is there a second?
Unanimously.
I guess that was unanimous consent. Thanks, Ms. Allen. Anything else for the good of the order before we go? Mr. Gripe?
Just a quick question. Dental insurance that we have. Thank you very much, King County. Just curious about, we've had some personal claim experience, so I started asking around some other people that, the plan is not paying much in some cases. I don't know how to evaluate that, apples and oranges with any other plan, but I promised some people I'd just ask and see, I don't know, what we can do to evaluate, because the medical plan, if I was just going to randomly assign numbers, I'd say 8, 9, 10, it's a very good plan. Dental plan 4 or 5, and that has nothing to do with you guys. It's just kind of how it feels when you use it kind of thing, the benefits you get, EOBs or lack thereof, that kind of, it's just I don't know how to frame that, but.
And certainly, we do look at other plans. A small out-of-pocket max, or I'm sorry, a small annual max benefit is when people are saying they're not seeing a great, payment on claims. That's because the out-of-pocket max isn't incredibly high, but it's pretty normal for dental plans. This is just how dental plans work. If you want a fully comprehensive dental plan that it's going to cost hundreds and hundreds of dollars, and then people be unlikely to take it. So our plan, while I agree, isn't, if you have a lot of dental work, it's not going to save the day. It's really a plan that gets you all your cleanings, all your basic work, fillings at a bargained for reasonable price. The one thing we did add a couple years ago to try to help was for a very small amount, you could add in what's called the wellness benefit. If you get all your cleanings, the amount, and you don't use it for anything and have any major problems, the amount of your out-of-pocket max goes up for a couple of years. So, that kind of helps a little bit, but you are correct. If someone has a lot of dental work, there is a lot left to be desired on it. And it's a balance of need versus cost when it comes to dental plans. We are fully insured on dental, which means we pay a premium and that premium covers it as opposed to being self-insured in the health plan. So we do compare rates every couple years. I think we did dental last year. Benefit versus rate, and the Cigna was still the best one. They also have a really good network in Cigna. So they have a lot of in-network people, as well as they will pay a benefit out of network equivalent to their in-network benefit. And then the employee just has to pay the balance. So they have actually a really wide and available network, which is one of the reasons we stick with Cigna. But we will price that out again and provide options. And if there's a general interest to see what a higher benefit plan would cost, we can certainly do that and present it with our options.
And the input I got wasn't, I'm sorry.
Go ahead.
It wasn't about major stuff. I'm sure that's possible, but it was like the number of cleanings. Somebody mentioned 3 exams, 2 like regular dental exams, and then a periodontal exam, which they counted against the exam limit. So the next cleaning and whatever, that wasn't covered because of that. So minor stuff like that, not the bigger stuff, but anyway.
And that might be provider specific because they're supposed to bill with a code that takes care of that. But certainly if people are talking to you, have them talk to me, and I'd be happy to have our staff work out what that problem is and try to figure it out with them.
Thank you.
In my experience in dealing with employee benefit plans. As we get older, that same dental plan doesn't seem as good as it was when we were younger, because when we were younger, they cleaned your teeth and took some x-rays once a year. And, maybe there was a little something, but as we get to the point that we're getting caps and crowns and those sort of things, and they pay not very well, they certainly helps. Anecdotally, because we have plenty of time, I can talk. I've carried dental insurance since I retired, but our retirement system last year added an optical benefit and a dental benefit. So my first dentist visit was the complete x-rays and the whole thing. The old plan paid about 80% of that because they don't pay for the full x-ray patch. The new plan paid 96 cents because it was put in as secondary and they automatically discount when they're secondary. So dental insurance is fun. No need for an executive session.
I do have one question.
Oh, well, sure.
Was just going to ask Mr. Sturgis how he's able to get rid of the snow in his backyard there. It's amazing how green it is. And
Yeah,
Wow.
stick
Mr.
around long
Surges
enough,
is-
you'll see the golf carts pulling right up to my back door.
I saw one go by while you were talking.
Did you? Sorry about that. I'll have the draperies on here by January. So, but I'm out tomorrow. I'm back to Chicago tomorrow. So,
All right. Anything else? Mr. Shepro.
There are, I find a whole stack of invitations from Mr. Cunningham's office. I
Yes.
don't know if they got passed out.
They
to
passed them around
everybody
yesterday. Yeah.
Thank you.
For the next crew,
That's next Wednesday, right?
Wednesday.
Yeah.
Next
It's
one.
The health
Number
department
7.
is starting earlier, and then the clerk's
I
office.
believe it's
starts at
preceded by
9:30.
a late starting public health meeting, 9:30.
Okay.
Weather permitting.
Anything further for the good of the order? Entertain a motion for adjournment. Greg moves second.
Seconds.
With a second, all in favor, say aye.